What do I think about inversion tables? I think they're awesome. I'm just hanging out today doing a video on inversion tables. Hope you enjoy it. Hi, I'm Dr. Joe DeMarco, chiropractor and owner of OcraMed Health, and today's video is on inversion tables. Now, I get asked a lot in my office what's my opinion on inversion tables, and here's my inversion table. I love inversion tables. I think they do a great job. All day long we have gravity pulling down on our bodies that causes compression, disc material between the vertebrae. The discs start to get compressed due to the gravity. Best way to undo the stresses of gravity, I like at the end of the day, is I get on my inversion table. Now, inversion tables are very affordable. A table just like this is probably around $150. They're very easy to use. Most of them have some type of a counterbalance so that when you do go upside down, they easily come back. So they easily swing back up. They're very easy to use. I'm going to show you how to use my inversion table today. Most of them are very similar, and I'll give you a little tutorial on how to use it. Now, most of them have some type of a clamp for your feet. So you're going to just step up onto the platform here, and most have a similar platform. And this particular model has a little hinge. You can bring the support right up against your shin so you're in nice and tight. If you haven't used inversion tables before, what you want to do is start off slowly. So I'm going to go back, and you just want to go a little bit past horizontal at first, just to get a little bit of light traction on your spine, and maybe stay in that position for 30 seconds, building up to 60 seconds, and slowly work back once you get used to it. I always recommend before you use an inversion table to check with your doctor to make sure, let them know you're going to use one and that you're going to be going upside down. So from this position, if you just lie back on your inversion table and you can hold on to slowly lower yourself, is I'm just going to take this just past horizontal. And the way to do that is to not bring the arms overhead. So I'm just going to hang in this position. I'm going to leave my arms by my side, and I'm just going to do all I can to just totally relax, let my body just stretch out on the table, and I'm going to try to deep breathe while I'm in this position, and I'm going to stay down here for about 30 seconds, like I said, building up to 60 seconds. Then I'm going to grab onto these handles, and you easily can come back up just like that. The way most inversion tables work is to go back further. All you have to do is bring one arm and then two arms, and I'll show you right now on this particular table how this works. Is I'm going to go back. By bringing one arm back, it takes you back further. And then when you let the second arm go back, you completely go pretty much vertical. In this position, once again, I'll stay here for about 30, building up to 60 seconds, and I just totally try to relax. I try to breathe through the position, and I just let the inversion table do its job and let it traction out my spine. It's very comfortable, and it's just great to use. When you want to come back up, most of these inversion tables have a counterweight. You just bring one arm up, the other arm up, grab the handles, and it easily brings you back. You unclip yourself. I know a common question people ask a lot of times is, how long do you stay inverted? I like to stay no more than, say, 2 to 3 minutes, and I'll do that a couple times. I like doing my inversion table at the end of the day, after the stress of gravity during the day. I like to use my inversion table in the evening. You can use it anytime you want, but I feel like I get great results with it using it at the end of the day. So if you don't have an inversion table, they're good to have. I strongly recommend it. They work great, and they're just so relaxing, and they're so comfortable, and they're just really, really good to help with a healthy spine. If you're looking for an exercise program that's going to build lean muscle mass without the bulk, then you definitely want to go to my website, www.ocramedhealth.com, where I will customize a workout program just for you, consisting of calisthenic and gymnastic movements along with weight training in a safe and effective way. If you're enjoying our videos, please subscribe to my channel, OcraMed Health on YouTube. If you have any questions about exercises or injuries, just leave a comment in the comment section below. I always try to do whatever I can to get back to you. And don't forget, OcraMed Health is keeping you fit forever.